And today I'm going to be looking at whether taste aversion therapy for alcoholism produces behavioural change. The article I've chosen is by Bolland, Meller and Rubetsky, Chemical Aversion Treatment of Alcoholism, Lithium as the Aversive Agent. So what is aversion therapy? Aversion therapy is a treatment method in which a person is conditioned to dislike a certain stimulus due to its repeated pairing with an unpleasant stimulus. So for the treatment of alcoholism, an aversive stimulus is paired with the maladaptive behaviour in order to reduce or eliminate that behaviour, attempting to create a conditioned response to alcohol consumption. So the article is Chemical Aversion Treatment of Alcoholism, Lithium as the Aversive Agent. This is the article that I'm analysing for you today. The rationale behind the study. Prior to this study, therapists would administer the alcohol after the beginning of the sickness in an attempt to pair the vomiting or the peak of the sickness with the consumption of the alcohol. There was concern that pairing an alcoholic beverage flavour with the peak of sickness may produce an increased preference because the flavour becomes associated with recovery from sickness. So the aim of this study was decided to expose the subjects to alcohol from the time the lithium capsule was ingested to 15 minutes after the noticeable start of the sickness. This ensured the exposure to alcohol before sickness began and withdrawal of alcohol before the peak of sickness. So this article has a clear hypothesis. It's that by administering emetic medications and exposing the patients to alcohol prior to and during feelings of sickness, the aversion therapy will be more successful. This was done in comparison to a control group where instead of undergoing aversion therapy, the control group was given titrated calcium carbohydrate, which is a deterrent, used as a deterrent to drinking. So the participants, there was 25 individuals who had been admitted to a general hospital psychiatric unit for alcohol dependence and addiction. These individuals showed dependence upon alcohol, defined as having exhibited a history of increased tolerance and craving for alcohol with one or more of the following symptoms: tremens, epileptic fits, or delirium tremens. After recovery from withdrawal from the alcohol, none showed evidence of brain damage or psychosis. They were males aged between 25 to 55 years of age. They all agreed that they were addicted to alcohol and abstinence was the treatment goal, and that all other medications would be withdrawn before treatment. In addition, they underwent a number of tests prior to the study just to check that their health was okay. So the method used in the study, so 6 sessions, 2 days apart, consisted of a complete treatment. During these sessions, the subject would take a mouthful of the designated drink given to them at the time of the treatment. They would swirl it around, taste it, and spit it out. Then the subject would consume the lithium carbonate capsule and wash it down with the rest of his drink. So the capsules would then cause sickness in the subject, and they would be directed to smell, taste, and drink small amounts of various alcoholic beverages. The exposure to the alcohol was terminated 15 minutes after the subject reported the start of sickness, or sooner if the vomiting seemed imminent. The patient remained in the treatment room until all symptoms of the sickness disappeared. So the results obtained in this study did not indicate that the innovations made on chemical aversion therapy in this study were superior to those used in previous studies. So overall, there was an abstinence rate of 36%. That was obtained 6 months following treatment. So there's a number of limitations in this study that I will go through. So the study mentions that There was limitations in the selection of their patients, so selection of the subjects. This justifies further investigation, particularly with a different population of patients. So the majority of the patients were unemployed, and also most of them had been brought into the hospital on an emergency basis. So overall, these patients were poor risks. They actually, in the paper, they mentioned that the treatment for chemical aversion therapy is of value mainly for the better circumstanced type of alcoholic patient, and that it is only occasionally successful with indignant, inadequate, psychopathic, or extremely neurotic patients. So, also, this study was done in a hospital, which does not replicate situations that the patients will face outside of treatment. There are doubts about the long-term effectiveness of aversion therapy. Patients may appear to be treated by the therapy, but once out of the view of doctors, where the deterrent drugs or electric shocks are removed, they may be able to return to their addictions or the undesirable behaviour. So we have a number of ethical considerations with aversion therapy as well. Significant controversy about the ethics, we're inducing vomiting, which is quite a vomiting long term, which is quite difficult thing to undergo. It also has history of using aversion therapy to cure homosexuality, to convert gay people. Also, there was issues with the control group. The main length of the stay was longer in the treatment group than the control group, and the patients subject to the chemical aversion therapy treatment averaged 5 years younger than those in the control group. Thank you.